How does streptococcal infection affect psoriasis? Imagine a tiny bacteria causing more than just a sore throat. When Streptococcus bacteria, especially group A Streptococcus, infect the throat, they can sometimes trigger or worsen psoriasis, especially a type called Guttate psoriasis. This connection is well supported by scientific studies and clinical observations. The way it works involves the immune system. Normally, T cells are your body's defenders, fighting off infections like strep bacteria. But in some cases, these T cells get activated to attack the bacteria in the throat and mistakenly target the skin as well. This happens because the bacteria and skin cells share similar proteins, called antigens. When T cells recognize these shared antigens, they become inflamed and attack the skin, leading to psoriasis lesions. The tonsils, which are part of your lymphatic system in the throat, often harbor the bacteria. When the tonsils trap the bacteria, they activate T cells that then travel to the skin. These skin-homing T cells express specific markers like cutaneous lymphocyte-associated antigen, or CLA, which help them find their way to the skin. These T cells belong to inflammatory subtypes called Th17, Th22, and Th1, all of which are known to play roles in psoriasis. Guttate psoriasis, which appears as small, drop-shaped red spots, usually shows up 1 to 2 weeks after a strep throat infection. It is more common in children and young adults. While this form of psoriasis often clears up within a few months, it can come back if the person gets another streptococcal infection. Sometimes, repeated infections can lead to a more persistent form called chronic plaque psoriasis. In some cases, removing the tonsils through tonsillectomy has helped reduce psoriasis symptoms and the frequency of flare-ups. This suggests that the tonsils play a role in maintaining the immune response that triggers psoriasis. To sum up, streptococcal infections influence psoriasis by activating immune cells that mistakenly attack the skin, causing the characteristic inflammation and lesions. This effect is especially strong with Guttate psoriasis following strep throat infections. Managing the infection or addressing tonsillar involvement can sometimes help control psoriasis outbreaks. If you notice your psoriasis worsening after a sore throat or infection, it's important to consult a healthcare professional for proper diagnosis and treatment. Remember, everyone's experience is different, and personalized medical advice is always the best course of action.